Hi, my name is Rachel Sintron, and I'm the Deputy of the Health Office at USAID Indonesia. Surasi was helping to build civil society in three specific areas, in DG and education and health, and not only to build the capacity of the local organizations, but also to look for cross-sectoral opportunities between DG and education and health. And this was because there's quite a lack of public services in many cases, and so we wanted to look to civil society organizations to help meet some of the social service needs for the Papuans.
And how do you think this has worked?
I think it's been really good. We've learned a lot from Surasi, from its inception and then these past couple of years. Prior to Surasi, especially in the health area, it was we mostly had HIV organizations because that's where the funding was. And so because we had put other types of funding into Surasi, such as maternal child health and tuberculosis funding, we were able to build the capacity of these local HIV organizations to do a little bit more than just HIV, and as well to work with other types of NGOs or community organizations to develop their capacity a little bit in health too. So I think we've really built a lot of capacity in Papua to be able to offer better services in health to Papuans, mostly preventive services, but getting a little bit more outreach. There's a lot of health challenges. I mean, if you look at the indicators for Papua, there are very high HIV/AIDS rates. There's high rates of maternal mortality, high rates of infant death, child deaths, and a lot of that is caused by just a lack of services. Even though there sometimes are puskesmas or there are hospitals, they don't often have the appropriate health service personnel, or they're underfunded. Drugs might be expired, and there's a lack of education on the part of people when to go, how to go, or a lack of funds to be able to go. So there's a lot of barriers to access. So what we were trying to do, since we were working not through the public sector but through civil society, was really to bridge that gap a little bit so that if people were not able to access services, they could rely a little bit more on what was already in their community. Knowledge about preventive health, such as hand washing, stopping smoking, clean environments, or information on when they should go to health services, and doing a little bit of outreach to get people who were suspects for TB to go to a TB clinic, people who might be at high risk for HIV to go get tested for HIV, those types of things. And so I'm hoping that just these organizations that Surasi has worked with are able now, even after USAID funding, to access funding from other donors and to continue the good work that they're doing from multiple sources. I think that's a really strong legacy, is just building that civil society capacity.